Hello, my name is Amanda Sturgeon, and this is my PowerPoint presentation on immunization and infectious diseases. Please disregard the background. I've moved recently and have 3 rooms of stuff behind me. Healthy People 2020 is a plan by the federal government to improve the health of Americans by identification of national objectives and goals. Some of the goals include to reduce health disparities, prevent disease, disability, injury, and increase the lifespan, create safe social and physical environments, and promote quality of life and health behaviors across the lifespan. Healthy People 2020's topics include increase immunization and decrease infectious diseases. This presentation will discuss the significance and prevalence, vaccine requirements for early and middle childhood, vaccine refusal, and advocacy and global health. Brief history of vaccinations. First one, 1796, with the creation of the smallpox vaccine. And you can see all the different ones. And almost 200 years later, in 1972, we had eradication of the smallpox disease, and the vaccine was eliminated. Between 1980 and 2018, we had creation of lots of new vaccines, and in 2000, we had elimination of measles in the United States. A goal of Healthy People 2020 is to achieve or maintain the vaccination rate of children ages 19 to 35 months from individual vaccine goals from 80 to 95% respectively. Here's a look at some vaccination trends from 2009 to 2017. And these are just for a 7 vaccine series listed right here. And these numbers are for all ethnicities and poverty levels combined. 2009 we had 44.3% vaccination rate, and in 2017 that was up to 70.4%. Here we can see some of the disparities. Blacks are up to 66.5%, Hispanics 70.4%, those below poverty level 62%, and whites 71.5% in 2017 for these particular series of vaccines. The significance. Vaccinations are a cost-effective preventative measure, and routine immunizations for each cohort can save 33,000 lives, prevent 14 million cases of disease, reduce healthcare costs by 9.9 million, and save 34 billion in indirect costs. Even with the vaccine programs, nearly 42,000 adults and 300 children die each year from preventable diseases. Many preventable diseases that were health threats for centuries have experienced a dramatic drop due to vaccine programs for infants and children. Here are some estimates in the decline and morbidity and mortality of rubella, measles, smallpox, polio, and diphtheria. These have declined anywhere from 99.9% to 100% due to vaccines. The prevalence. People in the U.S. continue to get diseases that are vaccine preventable. Since the 1980s, cases of measles, rubella, mumps, and pertussis have resurged. We've had incidence of hepatitis A decrease 95% and then increase 140%. 2018-19 flu season, 39 million people got the flu, and there were 24,000 deaths. 8,920 cases of TB in the U.S. in 2019, with 13 million people with latent disease. Measles eliminated in 2000, but then we had 600 plus cases in 2014, and in 2015 there was a major outbreak at Disneyland. We've had over 6,500 cases of mumps in 2006, which is the largest in 2 decades. So vaccine mandates. The first law mandating vaccines before starting school was for smallpox in Massachusetts in the 1850s. And by the 1980s, all 50 states had laws for entering school and vaccinations. Currently, 10 vaccines are recommended between birth and 10 years of age, and they are listed here in the gray. And 4 additional vaccines are recommended for adolescents, and they're here. Vaccines save lives. Childhood vaccination has proven to be one of the most effective public health strategies to prevent disease, and school vaccination laws have played a key role. Vaccine refusal and noncompliance. So, vaccination refusal is a growing problem and has directly caused outbreaks of communicable diseases. Some of the reasons for vaccine refusal are exemptions. Medical exemptions are allowed in all states, on religious grounds in 48 states, and philosophical objections in 20 states. Another factor in noncompliance is the misconception of side effects. The misinformation about autism and ADD being linked to vaccinations. Also, parents worried about the pain, the number of injections or shots they have to get, and making their child sick. Another factor is the cost and lack of access. There's lack of transportation, lack of insurance, lack of knowledge of vaccine programs, and lack of knowledge about the vaccines themselves and the diseases they cause. So, what can health providers do? Studies have consistently shown that absent or weak recommendations from healthcare providers are primary drivers for vaccine acceptance. I believe that. So, as advanced practice registered nurses, we can counsel parents, spend more time explaining the diseases that can be caused by non-vaccination, discuss the myths of autism, inform parents about research, give educational materials. We can increase opportunities for vaccinations, standing orders, give at any type of appointment, follow-up appointments, offer combination vaccines to reduce pain and the number of visits required, and improve accessibility, allow same-day appointments, walk-ins, have convenient office hours, send out reminders. And the government can help to enhance healthcare provider interventions to increase vaccination compliance by public message campaigns, public service announcements, have financial incentives such as gift certificates, free vaccines, and we can reduce allowed exemptions. They can increase the sites or available sites to get vaccinations, including school-based clinics, in daycares, pharmacies, inpatient hospital, and perhaps even home visits. Advocacy in global health. Infectious diseases are a critical public health, humanitarian, and security concern. As nurses, we must advocate for vaccine compliance, keep informed, and participate in efforts to increase participation in preventative measures and global initiatives. Provide culturally competent preventative care for a diverse population, working to strengthen and increase access to care and immunization programs in our schools and communities, and work to reduce health disparities in immunization rates, especially due to misinformation, cost, access, and socioeconomic disadvantages. And these are my references. Thank you so much.